Are you looking for relevant healthcare information? Log on to Medicircle and watch experienced medical professionals talking on common healthcare topics. Stay informed, stay healthy, stay tuned to Medicircle.
We at Medicircle are constantly working on bringing to our audience all the trending health related topics. It is our primary objective to bring to your attention news and views you need to be aware of to lead a healthy, disease free life. To help us in this regard, we'd be joined by eminent and expert top doctors from across the country. Today in Dr. Speak, we are going to talk about the problem of AIDS and ways to help you deal with it. Hello, this is Aprajita Mehra, and you are watching Medicircle. Today on our AIDS awareness series, we have Dr. Sajith Kumar with us. Dr. Sajith Kumar is one of the best doctors in Gandhinagar, Kottayam. He has been practicing in this field for 35 years now. He has completed his MD in General Medicine in 1987 from Government Medical College, Kottayam, Kerala, and his PhD in HIV/AIDS in year 2005 from MG University, again, Kottayam, Kerala. Currently, he is a professor of infectious disease in Government Medical College Hospital at Kerala itself. You are also first Kerala state physician for AIDS management since 1994 and also national trainer on AIDS for NACO, Government of India since then. He is also an expert in medical education technologies with NMC MCI since year 2005. It is our extreme privilege to have him here on Dr. Speak today at Medicircle. Welcome to Medicircle, Dr. Sajith Kumar. How are you, sir?
Thank you, and fine. Thank you for the nice introduction.
So, sir, my first question to you would be, what is AIDS and what causes AIDS?
See, AIDS is practically not a new disease now. It has been with for the last 40 years almost. It was discovered in America in the early days, particularly among the people who were practicing sex among males who were having sex with other men. Soon it was identified that this is caused by a virus, and this virus is called as human immunodeficiency virus, HIV for short. We'll use the word
Right.
HIV, and it's the short form of acquired immunodeficiency syndrome, which means the virus, once it gets into your body, it loses your immunity over a long period of time, extending over to many, many years. And gradually, your immunity is lost to a significant extent that your body will not be able to fight the diseases, even the common diseases. And sometimes microorganisms, bacteria and fungus, which do not produce disease in normal humans, start producing disease in these individuals. Call them as opportunistic. People also become vulnerable to some cancers which are not common in the general population. So all these illnesses, when it happens to these people who have been infected with this virus, we call it as AIDS. Virus, of course, is not a new word for the world right now because of the coronavirus. But HIV virus is far different from the coronavirus in the sense that it does not kill people immediately. It does not spread from person to person through air or water or by touch or contact. It is a disease which is predominantly transmitted all over the world by three main routes. The first and the foremost and perhaps the most important route is the sexual route, can lead to the infection in many ways. Subsequently, it came to be known to the world that maximum number of infections all over the world happens when men are having sex with women or vice versa. Also, when people are practicing sex without taking precautions. When they are going in for multi-partner sex or they go for sex with persons whom they are not very familiar with, that means that what we call as casual sex. This disease is also transmitted by body fluids, which means if a person comes into contact with the blood and body fluid of another person who is having HIV, this happens particularly in the hospital environments where needles are used. Also sometimes in IV drug abuse, when they are abusing narcotic drugs for intoxication, they share the needles and syringes because the drugs are very expensive and the needles are also not that easy to come for. So they share the needles and syringes, and in that process, if one of the partners or one of the friends are infected with HIV, virus can actually come through the syringe or blood to the next person, and this way also this disease is transmitted. The third mechanism by which this disease is transmitted or how the virus gets into the human body is when HIV infected mothers become pregnant. Children born to HIV infected mothers, not all of them become positive, but 1/3 of them can become positive, and this way the newborn child might be having HIV infection acquired from the mother. Now, this disease has been with us for the last, we have a lot of good information about this particular, but we almost know everything about this virus, the various subtypes, various variants. Just like we say in the case of coronavirus with multiple variants, HIV virus is also not just one virus. There are many subtypes and variants which are there. The common variants are HIV-1 and HIV-2. And HIV-1 leads to a serious disease, and HIV-2 usually leads to a milder. But some people can get infection with both HIV-1. One thing which differentiates this disease from other viruses is the long duration of illness. If somebody becomes infected, or if the virus gets into somebody's body, it does not produce an immediate illness. It does not even appear in the test also for the 2 weeks. In fact, the person can be detected as having infected only after 6 weeks to 3 months time. Thereafter, the virus continues to be in the patient's body, gradually producing a reduction in the immunity, which leads to an absolute loss of immunity or significant loss of immunity in a matter of maybe 10 years or 15 years, even without treatment. And during this period, the person remains absolutely asymptomatic, which means he will not have any illness and he will be another person.
Right.
It creates problems for the society because the people who are infected with the virus will appear absolutely normal. They may not have any illness. They may not appear sick at all. Therefore, they are also capable of spreading the disease to others. Because they cannot be identified easily, it's not possible to isolate them also easily. And isolation for such long periods is out of question. The reason why the disease still continues to be around, because it is related to sex, IV drug abuse, and behavioral abnormalities, tends to be more common in the younger individuals who are likely to indulge in such practices during their adolescence and early years of adulthood. So that maximum number of people all over the world becomes infected between the age of 15 to 20. This is the summary or gist of what AIDS is like. It has affected the whole world. It has affected the developed countries, the affluent countries, affected the educated population. It has affected the poor population. It has shown no boundaries. It's across the globe, and in almost all the countries, HIV-infected people are there, and they are gradually progressing towards the stage of AIDS. And unfortunately, they may be spreading the disease also to others whom they do not suspect as having. That is the scenario all over the world right now. So it's a slow virus. Right. It kills over a long period of time.
Sir, now that we know that it is like very dangerous, and the way that it is spreading across the, it's kind of a global problem. Sir, how can children and young people then be protected from AIDS?
Very, very important to be protected from AIDS because the infection happens at a stage when nobody suspects about it. Is having some behavioral relationship with somebody, or somebody is getting exposed through. The virus enters the body, and once it enters the body and it resides inside the nucleus of your cells. Hope people can remember what is meant by a nucleus. It is the small central part of the cell which controls the whole activity of the cell. Something where the genetic information about you is stored. So the virus gets in there, and once it gets in there, it's going to be irreversible. The most unfortunate part. It's just a casual contact. The virus enters the body, and it leads to an irreversible stage where the person is going to be positive, infected for the rest of his life. So this happens from a very casual exposure. Instances, this happens because you do not suspect the other person as having been HIV infected, being the potential of giving an infection to you.
Absolutely, since they are asymptomatic, right?
Yeah. Unfortunately, because it happens in the youth when, the challenges of taking more risk, challenges of exploring what is around, and the challenges of exploring various behaviors all over the world, young children have to be very, very careful about this. There are practically two ways by which the young individuals in a community can get the infection. One is by having sex with somebody whom you do not know. Somebody who may be having sex with so many other people, or having sex with multiple partners. Happen even from the adolescent stage of life, and we have seen that a large number of youth all over the world are becoming infected before marriage, what we call premarital sex. So what people have to be very careful about is to be very, very cautious in this instance, because you do not know who is the person who is capable of giving you an HIV. The second most important thing is about IV drug abuse. As I said earlier, use of IV drugs itself is a dangerous behavior. It can be a harmful behavior both to the body and mind. There is also the habit of sharing needles and syringes. Adds to the problem by increasing the chance of your getting blood and body fluid borne infections. It is not just HIV. There are various hepatitis viruses, so many other viruses which you can get. We are talking about HIV. This is one of the very common ways by which young individuals today are becoming infected. So if you're being careful with persons with whom you are going to have sex, and if you are going to be more careful with persons, with whom you are going to share the needles and syringes. In fact, these two habits are to be avoided altogether as much as possible. You will be able to prevent HIV. And HIV virus is not like coronavirus, as I said earlier. It will not enter your body without your permission. So you have to pave a way for the virus to enter your body. This is where we can be careful. Thereby we can prevent the infection. There is also a possibility that the virus can really get into your body through unexpected instances. These unexpected instances can be handled by using certain precautionary measures, about which we shall discuss.
Absolutely, sir. In fact, what I have surmised from this is being young does not mean that you have to be free and carefree, all the beautiful things that come with youth, but then you have to be very responsible. A bit of sex education would of course help. Not indulging in practices like premarital sex, where you do not know about your partners. You are taking drugs, which is in itself is such a harmful practice for you. So ideally, youngsters should not indulge in all these things, and if at all you do, you have to take necessary measures for it, and that is exactly what we are going to talk about next. So tell us some common prevention methods for HIV and AIDS.
As prevention methods are concerned, what is very important is to have an idea in your mind that any person whom you see across who looks very healthy, who looks exactly like any one of you, your friends or relatives, might be harboring the virus without they are also knowing about it. So the possibility of you are getting the infection from anybody and everybody whom you meet on the street, or you meet in your classroom, or you meet in occasions, has to be thought about. And one thing that the other person could be potentially able to give you an infection, then you have to, as much as possible, avoid a situation where the infection is likely to spread. To be frank, to avoid having unprotected sex with any person whom you meet on the street, or with any person who is likely to be infected, which means it may be a person who looks exactly like you, or like any one of your friends who are absolutely healthy. So consider or take into consideration this possibility that there is a chance of infection by having sex with anybody. Of course, there may be instances in the youth, there may be instances in the society where this is unavoidable. And in such situations, what is advised is to have only protected sex. Protected sex, what we mean is that there must be a barrier which prevents the direct contact between the male and female sexual organs, and between the male and male if it is being practiced as having sex with men. So the classical recommendation is to go for protected sex as much as possible, what we call a safer sex. Not absolutely safe, but this is safer compared to unprotected sex. And this is envisaged by using condoms. Condoms, as you know, has been with us for a pretty long time, for more than half a century now, for prevention of childbirth, for prevention of conception. But for the last 20 or 40 years now, we have been promoting condoms with the specific purpose of avoiding infections. Infections, particularly in those contexts where the chances are not thought about. So extensive use of condoms, particularly in casual contacts and in contacts where you are not sure about the other partner and the other partner is not a regular uninfected partner. This is likely to prevent infections to a large number. In fact, in countries like Thailand and in many African countries, it has been shown that extensive use of condoms significantly reduces the incidence of HIV infection in the community at large.
Right.
So this is the most important steps that is to be adopted. The second one, as I said, is about IV drug abuse. See, drug abuse itself is not a good quality at all. But all people are into the habit of abusing drugs. Move from IV drug abuse to oral drugs if possible. If that is also not possible, at least try not to share the needles and syringes. At least try to ensure that you use only disinfected or sterilized needles and syringes, and the used needles and syringes are always disposed properly. This way we will be able to prevent spread of infection through intravenous drug abuse, even if the person is continuing with IV drug abuse. Well, of late, the world is also witnessing another, sort of magical control for prevention of infection through sex. And this is by the use of certain drugs. There are certain drugs which are available now, which can be used with circumstances only, where the risk of transmission is there, but it is unavoidable. A classic situation is a sexual assault instance. For example, if somebody has been assaulted through sex, the chance that the other other person is likely to be HIV infected. Well, we can give some amount of protection to the affected person by giving certain drugs immediately. And for the next 1 or 2 days, these are tablets which are available with doctors. Of course, it's not freely available in the market, and we don't encourage the use to a large extent. Doctors can help you with certain drugs, what we call as post-exposure or pre-exposure prophylaxis. And this is using certain drugs which actually prevent the multiplication of the virus, even if it has entered your body. But the most important thing I stress again and again is behavioral change. That is very, very important. Behavioral change, ensuring that the unknown infection is unlikely to enter my body unless I give a way for the virus to enter my body. And this is something which the students with the youth has to be very, very careful about. That is, in simple terms, delaying sex as much as possible and having sex with a regular partner and having sex in a protected way using condoms. These are some of the measures which we want the younger generation to adopt so that they must be able to handle the situations. They used to say there may be many situations where, particularly in the situations in many countries, the girls must be able to say no in many instances firmly and strongly so that they not only protect themselves, they prevent the community also from becoming. All said and done, HIV is not a disease affecting one person alone. It's a disease which can affect the whole scenario in the family. It can affect the society in a large extent. So everybody has to be careful about this.
Ideally, from our platform that we are using, and this is for awareness and raising concern about certain things in the society, we should ideally suggest to our youngsters that you must use safe measures for every such thing, and especially say no to drugs. If you're educated, if you're smart enough to realize you're an adult, almost going to be an adult, then you should realize what is right and wrong in the life. So everything is not fun and games. We should be responsible for our bodies. We should be responsible for how we, grow up to be. And in that regard, we should definitely say no to drugs and not indulge such practices. So that brings us to our last question of this interview. And that is, what is the average life expectancy with treatment for HIV/AIDS today?
That brings a lot of comfort and pleasure into the minds of the healthcare providers all over the world, because when HIV started attacking the human population way back in the 1970s and 80s, probably there was practically nothing available for these patients. As I said earlier, there were certain infections which these people were very prone to develop, and the only way to treat was to treat those infections with antibiotics and antimicrobials, antifungals, etc. From the 1990s, we are in a position where there are lots of drugs, new drugs, which have been added to the armamentarium so that the doctors find it very comfortable now to arrest the progression of HIV into AIDS. From HIV-infected stage to the stage of AIDS, an uncontrolled, untreated patient, it will take about 10 to 15 years. But as of now, we have started treating all patients who have been detected HIV positive at the earliest opportunity. And this is achieved using, maybe one drug, one tablet a day, one pill a day, and nothing more than that. And we have got so many medicines which are available, and many of them are 2 or 3 medicines combined together into one single pill. I must say that, our country has been the forerunner in this. And in fact, India has been supplying antiretroviral drugs, as they are called, to the whole world. And India has been the pioneer in developing this single pill treatment. And now this has saved the lives of millions of people all over the world. And if you start treatment at the right time today with available resources, after doing all those necessary tests and investigations and all those things, if you start treatment today, you can reasonably assure that the person will have almost a normal lifespan. We have patients with us who have been on regular drugs for the last 30 years, right from the 1990s going on to the 30 years plus with treatment. And the lifespan that is predicted, of course, we don't know what is going to happen in the future. There may be newer drugs which are coming up, which may be able to even offer almost reasonable cure also for these diseases. But the lifespan of the patients can be almost the same if they take the medicines regularly. The last word is perhaps the most important thing. They have to be taking the medicines regularly. They have to be adherent to the medical advices and therapy. And if they're able to do that, and along with that, if they're able to modify their lifestyle and behavioral characteristics, don't think that the drugs alone will be able to help you. You will have to do a lot on healthy lifestyle and behavioral characteristics. And if you're able to, switch on to a better life, probably The lifespan could as well be the same as that of any other person who is not HIV infected. So that actually brings a large number of patients, a good life for the rest of their period. And not only that, that reduces the chance of hospitalization, the need for other medications, the need for doctor visits, and ultimately enabling most patients to lead almost a normal life. Just
now that the doctor has assured us longevity and also normal management of such a dreaded disease of one time, we would really like to thank Dr. Kumar for coming on our show and giving his precious time and insights with us here, and sharing them all with us at Medicircle. It was really a pleasure having you today, sir. Thank you so much.
Thank you very much for the opportunity.